How it works is we're converting electricity into electrostatic energy. So we're taking electrical energy and we're using it approximately a millimeter away from the skin. So when you see me actually performing the procedure, you'll see that the pen doesn't touch the skin. There's about a millimeter away. In that small distance to create a heat reaction in the skin. And that's what builds the collagen. It's a tricky question because all cosmetic procedures are going to be dependent on how well you take care of yourself. So just like carbon dioxide laser resurfacing, in theory the results are going to last several years, a minimum of 3 years. But if you age poorly or smoke or out in the sun a lot, that's going to be limited to a lot less time. I would say the major benefit is tightening without cutting. That is the biggest benefit. So if we're talking about the upper eyelid, we can tighten that loose skin without cutting, without creating any scar, without putting in any stitches. We can even tighten the lower eyelid, same thing, no cutting, no scar, no stitches. It's convenient, it's easy. If you simply want more, come back for a second session. If you want more, come back for a third session. But you're not relying on overcutting, overpulling, overstitching to get your result. So it's very natural, it's very easy, and super convenient. There's a little bit of downtime. So remember, this is a resurfacing procedure. It is ablative, which means we are in some way damaging the epidermis. So there is going to be time that the skin's going to need to recover. I usually tell my patients approximately 5 days or so, they're going to have these small little scar, like little eschar marks around the area. That's not scar, it's eschar. So it's a little brown dot wherever we put the plasma pen, and that's gonna go over, well, it's gonna go away in the next couple of days, but usually 5 days. The most I've seen is 7. Super easy. They just have to do 2 things. 1, avoid the sun, especially darker skin patients, and 2, just slather on Aquaphor over the area several times a day. We don't want the area to be dry, we want it to be nice and moist. That's going to facilitate the healing a lot, make it a lot faster, make it heal faster. Maybe instead of 5 days, if they're very good with their aftercare, we can get away with 4 days of recovery. It depends on where you go. And what part of the face you do and how many treatments you're going to do. I tell my patients that we're going to start off with 1 treatment, but they may need as many as 2 or 3. Depends on how loose the skin is, what we're trying to do, if we're trying to fix scar, or what our goal is, what our objective is. It's still a lot more cheaper than having a full face facelift or doing a blepharoplasty, and it's more convenient for patients. They're in, they're out, it's quick, it's easy, there are no stitches. There's all different kinds of candidates for this procedure. Obviously, it's not designed to replicate or remove surgery. So if someone really needs a facelift or a neck lift or an eye lift, they're going to need those surgeries. But for people that want to push the surgery off, or they don't want to do surgery, they want something easy, they want something fast with less downtime. So there's a lot of patients, men and women, that are going to be interested in this procedure.